Hello guys, so now we shall be discussing about Tinea Unguium. Okay, so now our topic of discussion will be about Tinea Unguium. Okay, now what is this Tinea Unguium? The most important thing, the first important thing which you need to know is that Tinea Unguium is also called as Onychomycosis. It is also called as Onychomycosis. Okay, Tinea Unguium is also called as Onychomycosis. Right, now the most important things which you need to know is the same things which we have discussed before. One is called as the location. Okay, one is called as a location, and after the location we shall be discussing the characteristics of the rash. Characteristics of the rash, and after that we shall be discussing the risk factors, and finally the treatment part. Okay, now let us start with the location. Now most commonly, where do you find this Tinea Unguium? I mean, Tinea Unguium infects which part of your body? It mainly infects your nails. So what all features will you find in a nail and tell that this is an infection of Tinea Unguium? The first important feature which I find is that there will be nail thickening. Okay, the second important feature will be there will be discoloration of the nail. Okay, the first important feature will be nail thickening. The second important feature will be nail discoloration. And the third important thing, there will be no pain or no itching. There will be no pain or itching. So what are the important things, guys? So first thing is that we have to look at the location. Next we have to look at the characteristics. Regarding the characteristics, the first thing will be nail thickening, then nail discoloration, and there will be no pain or itching. Now when it comes to the risk factors, the most important risk factor is occlusive footwear. Apart from this occlusive footwear, if the feet is most of the time in the warm temperature, right, hot and warm temperature, then there are high chances that this infection can develop. So hot and warm environment. So that is the reason why you should time to time sanitize your shoes, sanitize your socks, clean them, wash them time to time to avoid such infections. Now regarding the treatment part, the treatment will always be topical antifungals. But if more than 3 nails are involved, you can't keep on writing to every nail and waste the cream, so you give oral antifungals. But if there are more than 3 nails involved, you can use oral antifungals. Okay, so whatever we discussed, let us look at the picture. Before looking at the picture, we shall be discussing this. The first thing is, this is also called as onychomycosis. Location is mostly in the nails. Coming to the characteristics, nail thickening will be there. Nail thickening, nail discoloration, or there is no itching or pain. Coming to the risk factors, occlusive footwear, hot and warm environment is the most important thing. Coming to the treatment, topical antifungals, and next more than 3 nails are involved, then you give oral antifungals. Okay, so let us look at the picture here. Now look at the picture. This patient has involvement extensively to one finger, right? So this is how it looks. So there is nail, shape of the nail is changed, the nail has become thick, there is discoloration in the nail, right? So this is called as Tinea Unguium. And I think patients only one nail is involved, so we basically give topical antifungal creams. So this is all you need to know regarding this Tinea Unguium. Thank you so much for watching my video. Goodbye.